IFD is Integrated Facility Design, and it's a process that we're using in pre-construction for the building of our new Acute Care Centre. Integrated Facility Design workshop or weeks involve bringing the teams together to then look at the plans that have been developed to date, mock those up so they're done on a large scale with cardboard to the level of the patient rooms, the support areas, the family areas, everything. So those are all mocked up by floor. And what the teams do during the week then are walk through the flows, so the flows of patients and families, the provider flows, the flows of equipment, medications, supplies, and information. We walk through those flows and make sure that the way we have planned the layout actually works.
It's absolutely amazing what we're doing here. It's groundbreaking, and it's really a completely new way of thinking about construction of a hospital.
What a nursery looks like on paper and what it feels like on cardboard are different. You have to walk the cardboard before you realize just how big the differences are and the distances are.
What surprised me most about the tour today is the actual scope of it. It's big, and the areas are big. And I was actually really surprised how long it took to walk from one end of emergency to the other.
We're looking very carefully and saying, but now we're making the family go from here to here to here. We can make that better. And I think some of the ones when we first did some of our first IFDs, like in the ICU, we realized that really clearly. We said, but this really doesn't fit for the families and the patients. We need to, and we'd take down walls and we'd rebuild to create much better flows.
We have within each room what we call a provider area, a patient area for the baby, and a parent area where the parents can stay. And they are encouraged to be there more. They're with their baby more. It facilitates not just bonding, but gets the babies discharged earlier because the parents are more involved with their care, especially during that transition period at home.
I think having just gone through this area, it's absolutely phenomenal to actually see rooms. Even though the equipment isn't in the rooms, it's very visual.
For me, I want to see everything that's going on. I think it's just really interesting, and I think it's important to be able to have a voice and say what we think works and doesn't work.
The thing about the IFG that makes it so special, I think, is that we can actually walk around the space the way it actually would be and get a sense of how large the space is, get a sense of where the corridors are, where the elevators are, and really walk the walk as if we were a patient or a care provider in the building. And that is completely different than what you experience from a one-dimensional drawing.
I think what we've learned is just how important it is to actually truly do what we're doing, which is come down on life-size models and examine what happens to our patients. Where do they flow? How do our supplies flow? How do our providers flow? And try and put it together so it is not only efficient, but the core of it, we're really meeting patients and families' needs.
What we learned in the last IFD was, especially with our relationship with the NICU, is we actually have attached the NICU procedure room to our operating theaters so that we can keep our patient populations together and closer.
And as we build a new nursery for the future, we're looking to a very different model of care, having a single room nursery as opposed to one where many of the babies are in one continuous space.
We're looking at having them do their postpartum stay in the NICU so that we're not separating the mums and babes, which is something that we had not historically considered.
So it was an eye-opener, and I think everyone came out of that feeling, wow, I think we really made a breakthrough change.
How we are going to provide our care is so different and much more efficient.
The way it actually gives us a patient-centered perspective, so we can truly follow the journey of what's most important to us, which is our patients. And we can think about that not just on paper and not just on a timeline, but in 3D in a real-world perspective.